Welcome. I'm Greg Roskopf, and I'm the owner and developer of Muscle Activation Techniques. And today we're going to talk, a little bit about the billion-dollar industry, back pain, and talk about the idea, literally from a muscle activation technique standpoint, how myself and how we teach and look at the idea of back pain. And I come from it from a personal experience. When I was 19, I had a fractured vertebrae and had a lot of residual issues. And typically, we think, a fracture should heal within, 8 weeks. And for years, I had chronic problems. And I always felt it was interesting because I always felt that it was muscular. Like I'd get out of bed and I wouldn't be able to move or stand up, and muscles were spasmed and tight, and so I always felt like it was just a muscular issue. And so fractures should heal in 6 to 8 weeks, and I'm dealing with these residual issues for years. And one of the things that happened is I was chronically tight. And prior to the accident, I didn't have this tightness. I was athletic. I played football for 17 years, and I never had the type of tightness and restricted motion, let alone the pain that came with this, with the injury. And so for years, I was just trying to figure out, like, literally, what's wrong with me? And I sought out specialists in every field. From chiropractic to physical therapy to podiatry, literally sought out specialists in every field to try and get an understanding of back pain and the relationship of literally the interrelationships of joints, and gain an understanding of how the foot, the ankle, the knee, the hip, and the trunk, and how everything was interrelated. And the interesting thing is that as I sought out these specialists in every field, the common denominator was the reason that you're having all these problems and the reason that your back pain isn't going away is because you're tight. Your hip flexors are tight, your quads, your hamstrings are tight. They basically just looked at tightness as being the cause of all of my issues. And now at this point, by the time I'm 25 years old, not only did I have the back pain, but I had a lot of residual issues. I had patellofemoral syndrome, plantar fasciitis, SI joint dysfunction, all the way to neck pain. It just seemed like I had one injury after another. And literally, like I said, I'm sitting here, I'm at 25 years old thinking, what's wrong with me? And if I'm this bad at 25, what am I going to be like when I'm 50? And so it was kind of interesting when early on in my career, I'm working with a physical therapist. I started out as a strength and conditioning coach at Fresno State, and then I was an exercise physiologist for a sports performance physical therapy center. And I had this physical therapist that I worked with named Richard Jackson, who taught classes across the country on low back pain and SI joint dysfunction. And he taught mobilization techniques on how to get, basically get the bones to move properly. And so one day I came into work and I'm having some significant back pain. And Richard Jackson, he was going through an evaluation. He had a background in biomechanics, and he mobilized my big toe joint. And he was noticed that MTP joint wasn't moving properly. He mobilized the big toe joint, and my back felt better for a day. And I'm like, literally at that point, I'm like, how can my big toe have anything to do with my back pain? And that got me looking at and starting to understand biomechanics of movement, and looking at how the foot, the ankle, the knee, the hip, and the trunk, how everything's interrelated. And that if you have abnormal motion in one joint, you can have increased stress on other joints and tissues up or down the chain. And so I kind of went down that path and kind of looked at the biomechanics of movement and tried to gain an understanding, because now I had patellofemoral syndrome, plantar fasciitis, and all of these different issues. And it all originated from the fractured vertebrae that I had when I was 19. And so I really was trying to look at the body and gain an understanding of the body, and also gain an understanding of pain, because I was a strength coach. And as strength and conditioning coach, when I was working at Fresno State, if guys were injured, they went to the training room and we didn't see them. Once they got healthy, then they could come back and start to work out. But we really didn't have an understanding as strength coaches on the muscle system's role in chronic pain or injury. And I felt like that gap needed to be bridged. And that's what I feel with the development of muscle activation techniques. I started looking at that, like, what is this gap between the muscle system's role in chronic pain? Because the one thing that I have to say as we talk through this session today is I have a master's degree with an emphasis in exercise science. So I don't have a medical license. I don't have the license to diagnose or treat pain. And so in the process that I work with, I understand the relationship between muscle function and pain. And we're looking at the idea of where there's abnormal muscle function can be what is contributing to people's pain. So I don't treat pain directly. If somebody comes into me as a client and they have low back pain or they have patellofemoral syndrome, I'm trying to look at the muscle system's role and how it relates to that pain. And the pain, understanding the biomechanics, the pain can be far away from where the dysfunction is. And so that's kind of the foundational principles behind all my work over the years, and all the specialists that I learned from is there's a biomechanical basis behind all injuries. And the first thing that we have to look at is the structure. The structure dictates function. The structure of a joint dictates the function of the joint, but the function of the muscles dictate whether or not the structure can move the way it's designed to move. So you think of it from a spinal mechanics standpoint. The structure dictates based on the orientation of the lumbar spine. The lumbar sacrum or the lumbar facets, they basically are the articular processes line up against each other. So the structure dictates that there's very little motion in rotation through the lumbar spine. But as you move up the spine, those articular processes become more horizontal in nature, and you get up in the cervical spine. And because those articular processes are more horizontal, it allows each segment to move upon the other segments, which in turn allows for great amounts of range of motion in rotation in the cervical spine. So the structure dictates function, but the function of the muscles dictate whether or not the structure can move the way it's designed to move. And that's one of the things. Muscles move bones, and muscles hold bones in proper alignment. So as a muscle specialist with muscle activation techniques, we basically we're muscle specialists. As muscle specialists, our job is to determine whether or not the muscles can do their job and move the joints the way that they're designed to move. And to keep it in simplistic terms, if you have a client that walks in and they're like, oh, I can't turn my head to the right, but they can turn their head all the way to the left, it's like, is that a structural problem or is it a muscular problem? And the key is typically it's a muscle dysfunction problem. And that's kind of where I came from as I learned through all these top specialists in physical therapy, chiropractic, massage, training. As I learned from all the specialists in every field, the common denominator was the reason that you have this pain is because you're tight. And with an understanding in biomechanics, some of these therapists could find, oh, you're tightening the hips and that's putting increased stress on your back, or finding problems far away from where the dysfunction was, but the common denominator was addressing the tightness. So if it's a chiropractic adjustment to increase the motion in the spine through mobilization techniques, like I talked about with the Richard Jackson that I work with, the common denominator from deep tissue massage, mobilization, chiropractic adjustment, all the different modalities. Now we have foam rolling, dry needling, these Theraguns. The common theme behind every one of these modalities is to try and increase mobility, to increase range of motion. But the problem was that every time I would stretch or get deep tissue massage, I couldn't get out of bed the next day. I'd have numbness and sciatica down into my big toe. And I'm literally saying, what's wrong with me? I understood the biomechanics of motion. I understood how the foot, the ankle, the knee, the hip, the trunk, all the way to the occiput was all interrelated, and understood that motion somewhere down the chain could put increased stress on other joints up the chain. But everything I did to try and help myself pushed me further down the downward spiral. And that's when I had to take a step back. I had to take a step back and look, like, why? Why am I so tight? I never had this associated tightness. Why am I so tight? Does the nervous system just say, you know what, I'm going to mess with you and I'm going to tighten up all your muscles? It's the nervous system's actually trying to protect itself. And I took a step back and I realized, really thought about it. And think about when you walk on ice. When you walk on ice, what do? You tighten up as a protective mechanism. So the natural neurological response is when the body senses instability, it tightens up as a protective mechanism. And so I thought maybe this tightness is due to some other underlying problem, an instability issue. And what did that mean? I really didn't understand what this meant, but I had the fractured vertebrae, and that kind of kicked off all of my residual problems over the years. And so is this an instability issue that is causing this protective tightness? And that whole idea is, as we talked, the natural neurological response is when the body senses instability, it will tighten up as a protective mechanism. So could this tightness be a result of some internal instability issue? When we walk on ice, it's the external surface that causes the protective mechanisms in the body to tense up and tighten up and revert ourselves toward the center of gravity. But could there be an internal mechanism that causes this protective tightening in the body? And so I started looking deeper into that, and I started having, literally, I had the opportunity. I was a biomechanics specialist. I was a strength coach. I had my degree in exercise science. I was able to learn from some of the top specialists out there, from this Richard Jackson, the physical therapist, Gary Gray. 30 years ago, I was one of the first non-physical therapists to ever be allowed in his courses, and it was basically functional movement, understanding the interrelationships of joint. So I became this functional movement range of motion specialist. And it got me hired all the way in professional sports, focusing on tightness, focusing on imbalances in the body that were represented by tightness. And I got hired by the Utah Jazz through the end and worked 10 years with the Utah Jazz through the end of the Stockton Malone era, and worked with John Stockton, on a regular basis over the years, and had the opportunity to work with the team chiropractor. His name was Craig Bueller, and Craig Bueller did manual muscle testing. He did manual muscle testing, and basically through clinical kinesiology, he had different reasons for doing it. They looked at, it could affect when you have weaknesses. It could be due to some internal issues, some organ dysfunctions. It was a whole different field that I didn't understand. But the one thing that I did learn from him was, that manual muscle testing had a place. And as I worked with him, I started finding out that every time I saw a limitation in range of motion as a range of motion specialist, there was correlating muscle weaknesses. And so it's like, wow, they're tight here, but they're also weak. And one of the big keys was hip internal rotation. I'll use my shoulder as an example so you can see it. But if somebody can't move into external rotation, all of a sudden I test the external rotators through manual muscle testing, and they would test weak. And on the side that had more mobility, they would test strong. And there seemed to be a correlation that everywhere the body was tight, there was weakness. And so maybe this tightness is a protection due to some weakness. So over time, I started recognizing that and looking at it and realized that, wow, throughout the body, wherever somebody can't move, it means that the muscles that move you in that position aren't contract efficiently, or aren't contracting efficiently. So I started recognizing that correlation, and then I started actually created activation techniques to get these muscles stimulated. And all of a sudden, it's like I would get the muscles activated that were testing weak, and all of a sudden, immediately, the range of motion would open up, and they'd have strength through a greater range of motion. So I was kind of confused at the time and trying to learn and understand more about this. And you think about it, again, I started out saying muscles move bones and muscles hold bones in proper alignment. And when muscles can't contract efficiently, they can't do their job to stabilize joints and protect us from injury. And so basically, as I looked deeper into it and recognized that basically when we have protective tightness, it's usually it's after an injury, like my fractured vertebrae. It occurred my whole nervous system changed the way my body moved after I had that fractured vertebrae. And it started protecting through compensatory mechanisms. The body started going through protective modes, and all of a sudden it changed the way I moved all the way up the chain. And next thing you know, I have increased stresses on different joints and tissues, and I have patellofemoral syndrome, plantar fasciitis, SI joint dysfunction, all these different problems, all these different pains. And it had to do with the original trauma of the fractured vertebrae. And it wasn't this trauma to the spine that caused my issues. It was the traumatic event that caused muscle inhibition and caused associated muscle weaknesses that caused my problem. You think about it when you sprain an ankle. You sprain an ankle and you try and walk on it and you can't put any pressure on it. You can't put any pressure on it because the muscles that support it, yes, the ligament has been stressed, but the muscles that support the ankle have been weakened. Those muscles have been weakened by inflammation. They got stressed, they got overworked, and then the ligament actually got, basically if we take a step back, ligaments don't have the contractile ability to stabilize joints. Muscles do. So when the muscle system can't do its job to tolerate the forces that are placed through that joint, you exceed the tolerance level, the Golgi tendon organs fire, it shuts down the muscles, and then the ligament becomes a tension regulator, and that's when you tear ligaments. So when the muscle system fails, ligaments end up taking the stress, and they don't have the contractile ability to stabilize joints. So you think of that with a sprained ankle in just general terms, is whenever you have stress, trauma, or overuse, the resultant inflammation alters the communication between the nervous system and the muscle system. The muscles actually get weaker. The communication pathways get altered. And the best thing that I can say is it's like having loose battery cables. It's like the brain and nervous system sends information to the muscles and it's just not getting there. The muscles can't do their job. They can't contract on demand. And when they can't contract on demand, they can't do their job to stabilize joints and protect you from injury. So inflammation becomes the factor, overstressing the muscles, stress, trauma, or overuse. Overloading the muscles is what causes this muscle weakness or this instability issue, because the communication pathways are altered. And then those muscles can't contract and contract on demand. And then the body has to protect. So it tightens up as a protective mechanism. And the interesting thing is when the muscle can't contract efficiently, it can't shorten effectively. When it can't shorten effectively, it can't move the joints, the associated joints or the structure the way it's designed to move. So let's go back to my analysis or the example of cervical rotation. If somebody can't turn their head to the right, it's because the muscles that create right cervical rotation can't contract efficiently, so they can't fully shorten. When muscles can't shorten effectively through reciprocal inhibition, when muscles contract through normal motion and with reciprocal inhibition, when muscles contract, it sends an inhibitory response to the antagonist muscles so that those muscles don't tighten up to allow the agonist muscles to fully contract through its range of motion. When a muscle loses its ability to contract due to stress, trauma, or overuse, that muscle loses its ability to contract. You not only lose the ability for the agonist muscle to fully contract through its range of motion, but you lose the inhibitory response to the antagonist muscle. And that antagonist muscle shows up as being tight. And so tightness can be secondary to weakness. And that's what I started finding when I'm working with Craig Bueller, the chiropractor for the Utah Jazz, is wow, every place I see a limitation in range of motion, I perform a manual muscle test in that end range of motion, in the extreme of range of motion, and that test's weak. Because the weakest point, when muscles can't contract efficiently, they can't fully shorten, the weakest point of that muscle is the shortened position when you have these altered communication pathways. So the body's going, just like when we walk on ice, the body's going to revert itself toward the center of gravity and not allow you to move through those extremes of range of motion. And so that's that was the eye-opener to MAT. When I started seeing that it's not the muscles that are tight that are resisting you from moving into positions, it's the muscles that have been weakened that can't shorten effectively, and that's why you can't move into the extremes of range of motion. So I have this chronic back pain for over 10 years at this point. I can barely bend down to touch my knees, let alone my toes. And literally, I would stretch my hamstrings and get deep tissue work and try and increase range of motion and never see any changes. And like I said, then I couldn't get out of bed the next day because I had numbness and sciatica down into my big toe. And all of a sudden, how many people, I guess I'll take that step first, how many times have you seen clients that you work with that stretch day after day after day and they never get any more flexible? And that's how I was. I was never seeing any long-term changes in flexibility. At the moment you feel good because you've got blood flow, circulation, and you might loosen up a little bit, but the minute you put forces back on the body goes right back into a protective state and tightens up, just like when we walk on ice. And I realized the goal with muscle activation techniques is to melt the ice. If you provide a sense of stability, the body will give you all the mobility in the world. And so literally I had one of my guys that was working with me, when I put this process together and I realized my hamstrings and low back muscles, we've been focused on trying to get those muscles activated and stretched out. And all of a sudden I said, you know what, let's go with these principles that I'm seeing with my work with the Utah Jazz. And we got my hip flexors and abdominal muscles activated. All of them were testing weak. My hip flexors and abdominals were testing weak. When muscles can't contract efficiently, they can't shorten effectively. So my hip flexors and abdominals weakness were limiting my ability to bend forward and touch my toes. When we got my hip flexors and abdominals activated, I bent down and touched my toes for the first time in 10 years. And that's when I knew I was onto something. We've been focusing on the tightness forever. And it's not the tightness that was causing all of my problems, it was the weakness. The inability for muscles to tolerate forces. You think like we have a sprained ankle and your muscles are weak, you can't tolerate the forces like you used to, and you try and step on it and the body shouts out in pain saying, I can't tolerate the forces that you're putting onto my ankle because these muscles are too weak to support that body weight. So the tolerance levels of the muscles become the key. When muscles can't contract efficiently, they lose the ability to tolerate forces. So whenever you have stress, trauma, or overuse, it's that inflammation alters that communication so that those muscles can't contract efficiently and those muscles get weaker. And those weaknesses show up in the extremes of range of motion. So just like when we walk on ice, we go back into our protective state. We tighten up. So the natural neurological response is when the body senses instability, it tightens up as a protective mechanism. So my whole paradigm changed. The day once I learned, when I realized I could touch my toes by getting those muscles activated, changed my whole, I was a range of motion functional movement specialist. And what I realized is that we're only as strong as our weakest link. And the integrated system is only as good as the function of its isolated parts. So I had been used to, through my career, going through range of motion assessments through the spine, through the hips, through basically every joint in the body. But I went through those assessments with the focus that here's the tight muscles, we need to loosen those tight muscles up. And I failed many times with those. But the greatest failure was on myself because I never got any better, and then many times I got worse with the same principles that I was applying on the athletes that I was working with through the time. And then I realized that when it's a muscle instability or muscle weakness issue, not a tightness issue, that's causing most of the problems. And I started implementing this into my day-to-day work and realized I never had to stretch a client again. Once I got muscles activated, it was like melting the ice. I melted the ice, the body says, you know what, I don't have to tighten up and protect anymore because we have stability now. And that's what we're going to talk about and look at too, is what does stability mean to us? In a spinal neutral, we're working on core stability. What does core stability mean to us? And if we're stable in a neutral position, does that mean that we're functional? That our muscles can contract and provide stability through great ranges of motion? Because if we stable, we think about it when we walk on ice, we revert ourselves toward our center of gravity, so we revert ourselves toward neutral. So neutral is the position that we revert to when we're unstable. We lose our ability to move through great ranges of motion when we're unstable. I couldn't bend over to touch my toes because I had an instability issue. It wasn't, I did all the spinal neutral exercises in the world. I'd lay there holding my spine neutral, lift my legs, lift my arm, doing the bridging, doing all these movements to try and hold my spine in neutral. And I never got any better, because what I still couldn't do was I couldn't turn, I couldn't bend, I couldn't move. I was strong in neutral, but neutral is the position that we revert to when we're unstable. So it's not a bad position to start training your muscles, but in the big picture, we have to realize when muscles can contract efficiently, they can move the joints through their full ranges of motion. And then you should be able to tolerate forces through greater ranges of motion when muscles are contracting efficiently. So whenever you have stress, trauma, or overuse, that resultant inflammation loosens battery cables. It alters that communication between the nervous system and the muscle system. When I got my hip flexors and abdominal muscles activated, basically all we did was tighten battery cables. Tighten the battery cables to improve that communication between the nervous system and the muscle system, so those muscles could fire on demand. Then they could do their job to stabilize joints and protect from injury. And when I first created muscle activation techniques for selfish reason, it's what took my tightness and pain away. When you have altered communication due to inflammation, the first sign of that altered communication is muscle tightness, because the muscles can't contract efficiently. They can't fully contract through their full range of motion. The first sign of muscle dysfunction or muscle instability is tightness. And then if you keep putting forces on the body shouts out in pain saying, quit doing this until you fix the problem. So you think of going back to that ankle sprain. We're going to tie this all into back muscles, and how we look at back pain. But we think of that with the ankle sprain, and it's like, oh, I can't put any weight on it because it hurts. It hurts because it's dysfunctional. The muscles that support the ankle are dysfunctional. As you raise the tolerance level of the muscles, as the muscles get stronger, it takes greater amount of force to create that pain response. And eventually, as they get strong at the ideal optimal level, all of a sudden it's like, oh, I can walk on this with no pain. And that's an important factor, is there's an inverse relationship between mechanoreception and nociception. In mechanoreception, when I say we have loose battery cables, it's basically the inflammation alters the communication between the nervous system and the muscle system. The inflammation desensitizes the muscle spindle. And the associated muscle spindles. And so the muscle spindles regulate rate of change in length or change in length and rate of change in length of the muscles. So it's providing those sensory receptors of the muscle spindle, the intrafusal fibers that make up the muscle spindle are always providing sensory input back to the central nervous system. And you think about it, if I'm sitting here talking to you and I reach back and I put my hand on a hot stove, how do I know I put my hand on a hot stove? Because I have sensory receptors in the peripheral tissue that say, send that input back to the central nervous system that you just put your hand on a hot stove. And the central nervous system processes that information, and then it creates a motor response to say, get the muscles contracting, get that off of the stove before you really scald your hand. And so think about that. I'm sitting here, and for whatever reason, those sensory receptors are desensitized. You hear it with peripheral neuropathy with diabetics. These sensory receptors are desensitized. And you're basically saying, you just put your hand on a hot stove. By the time the central nervous system gets that information, you've already burned your hand. You scald your hand because you didn't get that reflexive component of activation to get your hand off that stove. So in the same way, you have sensory receptors in your peripheral tissues, you have sensory receptors in the muscles, which i.e. looking at it from the muscle spindles, which provide that sensory feedback about change in length and rate of change in length in the muscles. And so they're providing constant feedback to the central nervous system about the forces being placed on the tissue. And so when you desensitize the muscle spindle due to inflammation, desensitizes the muscle spindle. And when that basically sets it up where the muscles can't contract, they can't shorten effectively, all caused by inflammation. So that it's in the same way, if there's 20 pounds of force being placed on a muscle, the nervous system knows how to resist that 20 pounds of force. But only because it's getting input from the sensory receptors to say, create a contraction to resist that 20 pounds of force. But when you have injuries and you have inflammation, there's no longer that proper communication, and then the brain's like, I have no idea what I'm supposed to resist. And now those muscles can't resist the force. They can't tolerate the forces anymore. It's due to the decreased sensitivity of the muscle spindles, the associated muscle spindles. Well, there's an inverse relationship between mechanoreception and nociception. So your muscle spindle or your sensory receptors, they're your mechanoreceptors in your peripheral tissue that are providing constant feedback to the central nervous system about the forces being placed on the tissues and the changes in length on your muscle tissues. Well, there's an inverse relationship when mechanoreception, when you decrease the sensitivity of the mechanoreceptors, it increases the sensitivity of your nociceptors. So it takes less physical stress to create a pain response. Pain is actually a neurological response. When muscles are weaker, they can't tolerate forces. The first sign of that weakness is the body tightens up and protects. The second sign of that weakness is if you keep putting forces on that tissue, it shouts out in pain saying, quit doing this until you fix the problem. And that's the philosophy behind muscle activation technique. Fix the problem, identify where these weaknesses are, and basically these weaknesses associate with tightness, limitations in range of motion. And one thing we do not address when we're doing spinal neutral training is we do not address motion. We do not address the muscle's ability to contract through its range of motion in order to move the structure through the range that it's designed to move. So you think about the primary movements, in function with spinal motion and spinal movement. You see these people as they get older, their arms don't swing, they have no rotational motions going through their spine because they're basically stuck in a neutral dysfunctional position. But you think of the way the muscles are designed to move. We have muscles that have primary function to create spinal rotation. We have muscles that have primary function to create spinal side bend. We have muscles that have primary function to create spinal flexion, so you can bend down and touch your toes. When you lose the ability to move, and we can go through with spinal extension, hip flexion, hip extension, there's all these movements that would relate to core stability or spinal stability. So all of these different movements, we think of the movements that our spine is designed to move into. When we can't move in those end range positions and we notice protective tightness, it's because the muscles that move you there have lost their ability to contract efficiently. And when they lose the ability to contract efficiently, they can't do their job to stabilize joints and protect you from injury. Tightness is the first sign. You keep putting forces on the body, you have all these weaknesses, and you go out and start, swinging a golf club rapidly. You think about the amount of torque that's, placed through the spine with people that, play golf. It's like then your body says, wait a minute, I've been protecting you from going into those ranges. I've trained myself in neutral, and now you're taking me through these extreme range of motion. Creating all this torque, through the spine. It's going to shout out in pain saying, quit doing this until you fix the problem. So the key is, the one thing I want to focus on this is, like I said, with muscle activation technique, we're muscle specialists. We're muscle specialists in looking at the ability for muscles to contract efficiently, to stabilize joints and protect us from injury. We don't treat pain. I don't have the license to diagnose or treat pain. And I teach it to our students in the same manner, that we're not here to treat pain. There's enough specialists that are out there that will treat your back and will treat your spine, or when you have back pain, there's enough specialists out there that are focusing on the back pain. We're going to look at the muscle dysfunction and determine which muscles aren't contracting efficiently, because we understand the interrelationships of joints and how the foot, the ankle, knee, the hip, and the trunk are all interrelated. If you have limited motion in the lower leg and foot where your subtalar joint can't pronate, or that's not going to allow a valgus stress at the knee joint or internal rotation at the hip, which in turn can transfer more stresses into the spine. So it's we take a global look at the body and say, I always say, I don't care what you can do. I want to know what you can't do, because what you can't do is breaking you down. If you can't move into particular motion in one joint, your body's going to go and try and pick it up at another joint that provides similar motion. So if you can't achieve, if somebody's limited in hip internal rotation Every time they land and try and absorb shock, they can't get the internal rotation at the hip. It transfers up through the SI joint and in through the lumbar sacral facets. And one of the things I said right at the beginning is due to the articular processes being more vertical in nature, there's very limited amounts of spinal rotation that occurs in the lumbar spine. So if you can't get motion at the hip and it's being transferred into the spine, you may max out and jam those lumbar sacral facets and have this facet irritation, and the body shouts out in pain saying, fix the problem. And the problem may be far away from where the pain is. So pain is the check engine light. When someone comes in with back pain, they're complaining, I mean, I have pain, the check engine light's on. Then it's our role from a neuromuscular standpoint with muscle activation technique is to identify where they can't move. I don't care what you can do. I want to know what you can't do. And it could be a spinal issue, and it could be a problem somewhere far away from where the pain is. The pain check engine light comes on in your car, it shows up in your dashboard. That's not where the problem is. When the check engine light comes on, what do? You take the car to the mechanic and you understand that that mechanic understands anything and everything about this complicated piece of machinery, and they're going to open up the hood and evaluate everything and determine where the problem is. From a neuromuscular standpoint, if somebody comes in with back pain, they take it to a muscle specialist. We're going to look at this complicated piece of machinery through range of motion assessment and determine what they can't do. And because they can't do these particular motion, it means the muscles that move you there are not able to contract, and we got to correct the muscle dysfunction. We're not treating pain. And it's important to say that because from a personal standpoint, like I said, there's enough specialists out there treating the pain or the symptom. We're here to try and get from a neuromuscular standpoint to get to the root of the problem. Where's the muscle dysfunction that's leading with this inverse relationship between mechanoreception and nociception? Where's the muscle dysfunction that's causing the protective tightness and eventually sensitizing the nociceptors and causing pain? It takes less physical stress to create a pain response. So you think about it, the structure supports the, I mean, you have a support structure, but if you just had a pile of bones in your lumbar spine without muscle or ligamentous attachment, they will fall into a pile. It's the muscle contractions that allow us to have our spine in proper alignment. And so the structure is dictated by the function of the muscles. And so when we think of spinal stability, we have to think, is there stability through the independent spinal segments? Is there stability? Muscles move bones, and muscles hold bones in proper alignment. So is there instability through each individual segment in the spine? And then is there stability as we move away from neutral? We have local and global motion. And Vladimir Jonda was really great years back. I was one of his last courses looking at postural assessments and movement, and he came with these upper cross, lower cross syndromes. He had postural assessments and evaluations. And if you think of upper and lower cross syndrome, a lower cross syndrome, there's an anterior pelvic tilt with a lumbar lordosis. And if you see through postural assessment that you have this lumbar lordosis and anterior pelvic tilt, the idea is that you have the hip flexors and erectors are tight and your glutes and abdominals are weak. And because of that, you got the tight muscles pulling you, the hip flexors and erectors pulling you into an anterior pelvic tilt and the lumbar lordosis because the glutes and abdominals can't counteract the forces. They're showing up as weak. So the idea was stretch the tight muscles and exercise and strengthen the weak muscles. So I talked about whenever you have stress, trauma, or overuse, it alters the communication. The resultant inflammation alters the communication between the nervous system and the muscle system. And so it's like having loose battery cables. Until you tighten the battery cables, you can turn, if you had a dead battery on your car, you can turn the key to the ignition all you want. But until you jump start the battery, it's not going to start. So the same thing, if you think of neurological input and muscles, that basically when you have tight battery cables through the body, the nervous system, all it's doing is saying, I got to move. I need to get you from point A to point B. So the muscles that have tight battery cables, that have proper communication, are the ones that are going to contract and contract on demand. The ones that have had altered communication due to inflammation, they're going to be a little bit sluggish. So they go along for the ride. So any type of exercise, when we're thinking stretch the tight muscles and strengthen the weak muscles, any type of exercises that you do to try and create postural balance or create balance in posture is going to reinforce the dysfunction. The strong get stronger and the weak stay weak, and we end up magnifying the imbalances. And so that's the biggest key, is we have to jumpstart the muscles first, i.e. tighten battery cables by improving the communication between the nervous system and the muscle system so that those muscles can contract and contract on demand. Once you improve that communication, i.e. tighten battery cables, now you go and do your exercises, and the exercises are going to reinforce that. Just like when you jumpstart the battery on your car. You jumpstart the battery, then you drive it, it reinforces it. So you jumpstart the battery, get the muscles firing, and immediately those muscles start to, because they got, input from the nervous system, they become involved in every movement that you do. And then when you're doing corrective or postural alignment exercises, you're going to get the results that you're desiring. But until you jumpstart those muscles, the strong get stronger and the weak stay weak, and the imbalances get magnified. So it's important to recognize we have to almost take a step backwards before we can go forward. And so what are we looking at when we talk about spinal stability? We're looking at stability through motion. And through Vladimir Janda, he came up with tonic and phasic muscles, which are basically classified as local and global muscles. The local muscles are the muscles that attach segmentally up through the spine. You think of it, through the multifidus, longissimus lumborum, iliocostalis lumborum, they attach segmentally up each segment of the spine. Those are muscles that would be considered stabilizing muscles. That they're segmental muscles that stabilize each segment of the spine. But then you have global muscles. The global muscles are the big muscles. They're the torque generating muscles. They're the muscles that move you. So they don't have segmental attachments. They're, cover greater surface areas. They attach from the rib cage to the pelvis, your internal obliques, your external obliques, your longissimus thoracis, iliocostalis thoracis. These muscles don't have segmental attachments to the spine, but because of the alignment of the muscles, they're so far away from the axis that they're the torque generators. They're the ones that create the movements that I talked about earlier through side bend, rotation, flexion. The abdominal muscles, they're the muscles that create motion. So you have segmental muscles, and you have, with local and global muscles, you have the local muscles, which are the segmental muscles, and you have the global muscles, which are your torque generators. They're the ones that are designed to produce movement. So the local muscles are more slow twitch oriented. They have a higher percentage of slow twitch muscles. They're more segmental muscle. The global muscles are more fast twitch oriented because they have a higher percentage of fast twitch fibers relative to the ratios between fast twitch and slow twitch. But that's an important factor. They're all torque generators. They're all muscles that have to move. But some can be considered stabilizers and some are considered torque generators based on their alignment to the spine. And the way that I look at it is, first off, is whenever you have stress, trauma, or overuse, again, that resultant inflammation alters the communication between the nervous system and the muscle system. It negatively affects, when this altered communication, when muscles can't contract and contract on demand, it's because the inflammation negatively affects the slow twitch characteristics of the muscles. It actually creates metabolic changes in the muscles themselves, the muscle fibers themselves, where slow twitch fibers become more fast twitch in nature. So they lose the ability. The main thing is their threshold to activation increases. And when the threshold to activation increases, those muscles need more electrical current before they can contract. So there's the loose battery cable idea. The nervous system sending the information, slow twitch muscle fibers usually have the lowest threshold to activation, so they contract beyond our conscious control, reflexively. I have muscles contracting while I'm sitting here talking to you, holding my body in upright posture. It's the slow twitch muscle fibers that do this. And then as you increase electrical activity, then you recruit through Henneman's principle, you recruit up through the fast twitch fibers depending on the amount of load being placed on the tissue. But function is about timing. So our postural muscles, our muscles that provide stability to joints, need to be able to contract and contract on demand. So it's the slow twitch characteristics of the muscles that get negatively impacted. So they can't do their job they can't contract efficiently, but the timing is negatively affected, and then they can't do their job to stabilize joints and protect us from injury. Somebody comes up and shoves me from the side, I need a reflexive contraction that helps me to restore back to my normal, the muscles back to their normal resting length, beyond conscious control. Can't think about it. It has to just happen. And that's why people, as they get older and become more dysfunctional, they become more rigid in their movements, and they can't adapt. They can't adapt to unexpected loads because the muscles can't fire and fire on demand. You watch old people that are dysfunctional walk, and they look like the people walking on ice. The only difference is that the instability issue is an internal issue instead of an external, due to the external surface. So now we go back to local and global stabilizers. You have these torque generators that are producing motion through the spine. Then you have the segmental muscles that are providing stability segmentally through the spine. Every one of those muscles are equally important because every single one of those muscles have to be able to contract and contract on demand. And so even though the segmental muscles are the muscles that would be considered to have a higher percentage of slow twitch muscle fibers, all muscles in the body have a certain percent of fast twitch and slow twitch muscle fibers. And so inflammation negatively affects the sensitivity, or basically has a negative effect on slow twitch muscle fibers, where those slow twitch muscle fibers become more fast twitch in nature. I told you it changes the metabolic characteristics. And so regardless of whether it's a stabilizing muscle, if it's a slow twitch muscles and the slow twitch muscle, or slow twitch dominant muscle, and the slow twitch muscle fibers are negatively affected by inflammation, they can't do their job. They can't fire on demand because their threshold to activation gets higher. So now we think of the segmental muscles that are dominantly slow twitch fibers. They get inflamed. They're sluggish. They can't do their job to protect these segments. And so the best way that I like to explain that is think of the segmental muscles that attach to the spine. They're like the hinges on a door. Like the hinges on the door, if I came and I unscrewed them all halfway, and I just unscrewed the screws on every one of the hinges halfway, what would happen? You'd open the door and it'd be rackety. It's hanging on its hinges, it's rackety, and it's tearing up the wood that the hinges are on. It basically changes the axis of motion. So you think of segmental muscles in the spine, and these segmental muscles in the spine that are supposed to be holding the vertebrae in proper alignment to keep constant normal pressure on the discs and the articular surfaces. And all of a sudden you got loose battery cables that are like loose hinges, and every time you move, the torque generators, they're still doing their job. They're rotating the spine, and as they create, it's like me opening the door with loose hinges. As they create rotation or side bend or flexion through the spine, you got these segments of the spine that aren't stable. They're not being held in proper alignment through motion. It's not about stability in neutral. It's about stability through motion. If my hinges on my door are rackety and I'm a torque generator, I'm opening the door, I'm going to tear up the hinges. I'm going to tear up the door well. And so we need to tighten the hinges. So the first sign of an instability issue is, from a segmental standpoint, if these intrinsic muscles are not firing and are negatively affected by inflammation, the torque generators can do their job, but the body's just going to tighten up and say, we're not going to provide this instability. That's you got tightness. Second sign is pain. Think of the abnormal pressure that you can get on discs and nerve roots when those segments are unstable. But when everything's screwed in, when those hinges are tight, it just opens and closes. You got a stable foundation to move from. So the segmental muscles are important. But then we have the torque generators. The torque generators are those muscles that move you, the internal oblique, the external oblique, anterior fibers for rotation, lateral fibers for side bend, the abdominal muscles to flex the spine. These are all muscles that move the spine. Again, I said muscles move bones and muscles hold bones in proper alignment. These are all muscles that move the spine. They have the mechanical advantage based on their distance from the axis to create motion efficient motion through the spine. When they can't move, now we take the same idea. When you have stress, trauma, or overuse, the resultant inflammation alters that communication so that the muscles can't move through their full range of motion. They can't move the structure the way that the structure is designed to move. So now my internal and external obliques is like, oh, I can't turn to the right like I can turn to the left. Or it's like, because these global muscles, the torque generators, also have a certain percentage of slow twitch muscle fibers. They also have to be able to contract and contract on demand. So when you have stress, trauma, or overuse, that inflammation negatively affects the ability. Let's say you went out and threw a baseball, with your kid all week, and all of a sudden I'm left-handed, so all of a sudden the right rotation, those muscles that right rotate got overloaded and negatively affected due to overload. They had inflammation, and all of a sudden it's like, wow, my back hurts, and every time I try and turn to the right, my back hurts, and I can't turn like I could. Because tightness is the first sign of muscle dysfunction. Pain is the second. Every time you try and turn there, it's going to shout out in pain saying, quit doing this until you fix the problem. You overloaded these muscles. These muscles need to heal. They need to recover. Sometimes as we get older, they don't heal and recover on their own. And that's where you need to get those muscles reactivated and tighten the battery cables so that you can actually teach those muscles to start turning again. So limitation in range of motion is the first sign. And then pain. You keep trying to do that motion, it's going to shout out in pain saying, don't do this, fix the problem. So think about that. You have torque generators. I'm sitting there throwing a baseball with my kid. I got these torque generators that just got overstressed because I'm a weekend athlete and I've never done it, or I haven't done this in a long time, and I go out and stress muscles that aren't used. They weren't prepared to be stressed. Because I've been holding my spine in neutral and doing all my bridges and leg lifts and arm lifts and everything, and I never taught those muscles how to move through great ranges of motion. So the key to all of this is, like I said, the slow twitch muscle, the local and global muscles, your tonic and phasic muscles, they all have a certain percentage of slow twitch and fast twitch muscle motor units. The slow twitch muscle fibers are negatively affected by inflammation, where the threshold to activation, which is the main key, when you have inflammation, the threshold to activation gets higher. It requires more electrical current to create a muscle contraction. So they're sluggish. So the muscles that can contract will contract. I always say the body will get from point A to point B most efficiently with what it has to work with. Because the ones that can contract are going to get you there. All the body says is, you told me to walk across the room. I'll use what I can use to get across the room. The ones with the loose battery cables and not getting proper input are the ones that are just along for the ride. And you do exercise to strengthen muscles, the ones that have the activation or that have the tight battery cables are going to perform the motion. The body will always try and find a position of strength. Because it knows the nervous system's smart. The nervous system knows what it can and cannot do. And when you keep putting forces that it can't tolerate against that tissue, against those muscles, it shouts out in pain, saying, quit doing this until you fix the problem. I can't do this. My muscles aren't strong enough to do this. And so, like walking on your ankle, we put people on crutches first and or in a boot cast and try and allow those tissues to heal because they can't tolerate the forces of body weight. So it shouts out in pain saying, quit doing this until you fix the problem. But with muscle activation techniques, we're going to identify where these altered communication pathways are and then fix the problem. Give the body more to work with. The way that I look at it, it's a fight for dominance. You got muscles on each side of the axis, so if I'm trying to turn the body to the left and to the right, I got muscles that, basically have to move me to the left and move me to the right and move me to the left. They need to contract efficiently, but I can't have a counterforce from the other ones not allowing me to move. So if you think of it like a tug of war, with agonist and antagonist muscles, it's like a tug of war. If you had 10 250-pound men with equal strength in the tug of war on each side, they're pulling, that string staying right in the middle. They're going nowhere. But if you knock two of the 250-pound guys off of one side, these other muscles are pulling as hard as these other 10 guys are pulling as hard as they've been pulling. And all of a sudden, because you don't have the 2 guys on the other side, the 10 guys win over the 8 guys. So muscle functions the same way. If everything's firing properly, you have equal balance on each side. So one's not dominated. I go to turn this way, I won't have the resistance from the antagonist muscles through reciprocal inhibition. But if I have weakness in my right rotators because I was throwing a ball with my left hand with my kid all weekend, and I create weakness on those, all of a sudden I knock two of my guys off of the right side, so they can't move me the way they move. The other side, the left rotators are resisting. They're going to resist the motion and not allow me to move. They're not pulling any harder. So the tight muscles isn't the result of those muscles pulling harder. It's the result of those muscles not having the counterbalance forces from the opposing muscles, because the muscles got inhibited, or muscle fibers got inhibited in the muscles relating to right rotation. So the fight for dominance is being won by the side that got inflamed, or being won by the side that didn't get overstressed and didn't get inflamed, and they show up as being tight. So tightness is a sign of weakness, of neurological weakness. I didn't understand this when I had my chronic back pain, and I'm like trying to figure out where my problem was. I was strong. I was squatting 500 pounds, bench pressing 400 pounds. I was strong, but I was unstable. I was young. I was athletic, played football for 17 years, always in the weight room, but I had pain. I was in chronic pain after my fractured vertebrae. And then what I had to do was I had to find artificial forms of stability to try and make up for what my muscle system couldn't do. I had orthotics. I wore a weight belt. I'd wrap my knees. I'd wrap my elbows. I was doing anything I could to provide a sense of stability. I had strength, but I didn't have stability. And so I was trying to find artificial sources to try and give my body a sense of stability, because the muscle system couldn't provide that stability. The internal system, when you have muscles contracting and contract efficiently, you have those segmental muscles that attach segment to segment. They can do their job to stabilize the joints, each joint independently, while the torque generators create the motion. They're all got proper communication between the nervous system and muscle system, and movement is fluid. You move through great ranges of motion because you're stable through the muscle. You melted the ice. The goal of muscle activation techniques is to melt the ice. Provide a sense of stability, and the body will give you all the mobility in the world. I've been doing this for 25 or 30 years, and I tell you what, every time I have a client that walks in with back pain, it's a muscle weakness issue. The muscles have lost the ability to tolerate forces. And the common denominator with every client that walks in the door is they're chronically tight. Hip flexors, hamstrings, quadriceps, spinal rotators. I mean, it's amazing to me. I have golfers come in and they can't turn. And it's like, why can't they turn? Because those muscles that rotate the spine have lost the ability to contract efficiently. And they're coming in with back pain. And it's like you're playing a sport that requires rotation. These torque generators, these global stabilizers, or these global muscles need to be able to move you through great ranges, while the intrinsic local stabilizers are providing stability through the segments. The hinges have to be stable. The screws have to be fully screwed in. And these people come in and they're just chronically tight. They can't rotate. They can't bend. Their hamstrings and hip flexors are tight. And the focus has always been correct the tightness issue through deep tissue massage to stretching to mobilization techniques to adjustments. Again, I said muscles move bones and muscles hold bones in proper alignment. If bones aren't moving, it's because the muscles that move them aren't contracting efficiently. It's about stability through motion. You don't hear people complain that I hurt my back doing this, staying in neutral. They hurt their back when they bent over to pick up their kid, or they hurt their back when they were rotating back to reach and grab something from the back of their car. Or they went out and played golf and put these full range, end range rotational forces on a spine that wasn't ready to handle those forces because they trained themselves in neutral. We have to provide a sense of stability and teach the muscles how to move through their full ranges of motion. The first goal is get the muscles activated, tighten the battery cables, and this is all a technique. I mean, that we train trainers and therapists in muscle activation techniques. We teach people how to optimize muscle function. We don't treat pain. We identify and correct muscle dysfunction or muscle imbalances that contribute to chronic pain and injury. So it's a lot of information, and it's looking at it. The perspective is true throughout the whole body. If I have abnormal motion in my foot, it can put increased stress on my back. If I have abnormal motion in my hip, it could put increased stress on the back. If we focus on where the pain is, we may be far away from where the dysfunction is. So the greatest tool that we have as an MAT practitioner is the range of motion assessment. We evaluate range of motion, movement by movement, joint by joint throughout the kinetic chain in order to determine what you can't do, where you can't move. Because where people can't move, where they have limitations in range of motion, is an indicator that those muscles that move you in that range, those ranges are weak. They've had altered communication, they're inhibited. We need to correct the problem, get them moving. And I'll give you a perfect example to try and end this. Had Bryson Dechambeau, pro golfer. I mean, we've got all the motion. You see the strength. If anyone watches golf, his strength levels and mobility has been optimized. And he's hitting the ball the farthest out of anyone on the tour because he has mobility and stability. When he first came to me, he was tight. He was limited in with him, he was limited in right hip rotation, with external rotation, and he was limited in left spinal rotation. And he had back and hip pain. First sign is tightness, second sign is pain. And we got total body mechanics. We started finding that there were things in his lower leg and feet all the way up the chain that were limiting his ability to move. And the ironic part is when we got his lower leg and foot muscles activated, his total body rotation improved because he was more capable of supinating, which is a rotational motion that allows the tibia and the femur to externally rotate. He was in his backswing, I'm showing left-handed, but in his backswing, he was able to get about 20 degrees more motion up his chain through full body rotation to transfer into his swing. By getting more motion coming from the ground up, it took the stress off of his back. Because before he had that motion, he was jamming at end range and rotation through the spine, which was putting increased stress on his hip and up through the spine. Once we freed up the lower leg and foot, it dissipated the forces and he had more motion with less stress. He goes, I actually feel looser in my back and my spine. And it's because you're not trying to make all the motion coming from the spine, or all the rotational motion come from the spine. It's being transferred through every joint that provides rotational motion up the chain, which opened up his total body range. So it's looking at it from that perspective, movement by movement, muscle by muscle. That body has to be able to move. And when it can't move, it's because the muscles that move you there can't contract efficiently. So I think that idea of local and global stabilizers, with the idea that every muscle, there's no muscle more important than any other muscle in the body. And there's no muscles that you may have muscles that have a classification they have as being stabilizers because they're more slow twitch oriented, or their percentage of slow twitch muscle fibers is high relative to the fast twitch fibers. And you have torque generators because they have more fast twitch fibers relative to slow twitch. But every muscle in the body has a certain percent of slow twitch muscle fibers, and every muscle has to be able to contract and contract on demand. If they can't contract and contract on demand, other muscles will be forced to pick up the slack. So if your torque generators that have the mechanical advantage to create these rotational motions are inhibited, then all of a sudden your segmental muscles are trying to move the spine and they don't have the mechanical advantage to do that. They'll get overstressed and overworked and you will have back pain. So again, we're going to finish this off as muscles move bones and muscles hold bones in proper alignment. When muscles can't contract efficiently, they can't do their job. The first sign of muscle inefficiency is tightness. The second sign is pain. With muscle activation techniques, we don't treat the pain, we treat the muscle dysfunction. And that typically, because of the inverse relationship between mechanoreception and nociception, it typically results in a decrease in pain. It's a force tolerance. So thank you for being a part of this and listening. A lot of information thrown in an hour. I think the main thing, you can find out more information about muscle activation techniques, the processes, in our education programs. We teach these principles and the skill set to trainers and therapists across the country. If you're interested in more information, go to muscleactivation.com. Thank you very much for being here.